Awesome. Well, welcome, everyone. I am so glad that you have joined us today for Earth Day 2021, and also to celebrate and honor and recognize Dr. John P. Wyatt in this symposium focusing on environment and health. I first want to recognize Dr. Wyatt's family for their generous support to make this event possible. They have honored the legacy of Dr. Wyatt, who was a pathologist, who was one of the first physicians in the United States that air quality and air pollution specifically with lung disease. So this was before Earth Day even began. He was doing this research. So it's an honor for the University of Kentucky to hold this legacy of the connection between environment and health, particularly from a physician's point of view. So welcome to everyone. We're so glad you're here. I want to say that you are joined, I know, virtually, but in the spirit of camaraderie. There are over 360 attendees from all over the United States joining us in here in the meeting room today. So take time. There's a chat function. You might connect to colleagues that you may have not seen over the past year and a half. Just to feel a sense of connectedness. So this event also would not have been possible if it, from all of the other support from university partners. Dr. Wyatt left a legacy, a true legacy, because now there are over like 10 environmental groups on our campus. We have 2 NIEHS, which is the National Institute of Environmental Health Sciences, funded centers. One is the Superfund Research Center, and the other is the UK CARES, Center for Appalachian Research in Environmental Sciences. We also have participating today the Kentucky Water Resources Research Institute, the Kentucky Animal Disease Mapping Initiative, the Kentucky Geological Survey, our UK Office of Sustainability Global Environmental Health Initiative. We also have the Center for Clinical and Translational Science participating, the Tracy Farmer Institute for Sustainability and the Environment. So UK is full of wonderful environmental health research and work initiatives, and we're glad to assemble them all together today to make this event happen. I want to introduce now the keynote speaker for the John P. Wyatt Symposium. I am just so honored and delighted to have Dr. Howard Frumkin with us this afternoon. Dr. Frumkin is a professor emeritus of environmental and occupational health sciences at the University of Washington School of Public Health in Seattle. He served there as dean from 2010 to 2016. Dr. Frumkin received his medical degree from the University of Pennsylvania, and also his N.P.H. and DR.P.H. from Harvard University. He's not only an internist and dedicated occupational environmental health medicine specialist, but he's also an epidemiologist, one of my favorite fields. And now as we go through the COVID pandemic, we realize how important epidemiology is to our life and sustainability. Dr. Frumkin has spent his entire career examining the role of the built environment, climate change, energy policy, and today we'll hear more about that in his talk. Served as the head of Our Planet, Our Health initiative at the Wellcome Trust in London. He's also a past director of the National Center for Environmental Health at the US CDC, and also served as special assistant to the CDC for climate change and health. He has authored over 200 scientific journal articles and chapters, and also over 9 books focused on environment. And today we'll also be including his latest book, Planetary Health, Protecting Nature to Protect Ourselves. We'll be including that as part of a drawing and a raffle for those who complete the evaluation of today's event. We'll be giving away one of his new books. So without any further ado, Dr. Frumkin, welcome to this event, and I'm sincerely looking forward to hearing your talk on planetary health. Thank you.
Aaron, thank you so much for that nice introduction, and greetings, everybody. Happy Earth Day to everybody. It's very nice to be together. I only wish that we could all be together physically in beautiful Kentucky, but I know that as the pandemic comes to an end, we will be able to get together in real life before too long, and we all look forward to that. My topic today is planetary health, subtitled Human Well-Being on a Fast-Changing Planet. What I hope to do is introduce you to this exciting new field of planetary health. Before I jump in, I'd like to acknowledge that I'm speaking to you from Seattle, from the traditional unceded land of the Coast Salish peoples, and in particular the Duwamish tribe, which inhabited the land where Seattle is now. I honor with gratitude the land itself and the tribes, and I also want to acknowledge with respect and gratitude the Wyatt family for their support of today's events. My agenda is very simple, just three pieces. I'd like to introduce to you the paradigm of planetary health, work a few examples with you, and then end on a hopeful note, because after all, when we ponder the state of the planet, it can be a little gloomy, but we need to maintain lots of hope, and there's good reason to do that. So let's begin by talking about the paradigm of planetary health. And I'd like to ask you, even if you are a health professional, to channel your inner historian and your inner ecologist, because we need to think broadly and long term about the issues that I'd like to discuss today. I'd like to go over 7 key concepts with you: the Great Acceleration, the concept of deep time, the Anthropocene, planetary boundaries, the donut, ecosystem services, and the concept of polycrisis, some or all of which may be new. So let's begin the story here at the bottom of a coal mine in Scotland in 1860. This is where planetary health may begin. Now, at the time this picture was drawn, coal had, of course, been known for a long time and had been used for over 1,000 years as a source of energy. But at this point, it was being used on a very large scale, making energy available on an unprecedented level and revolutionizing industry. I like this picture because this seated gentleman apparently thought it was appropriate to go to the bottom of the coal mine while wearing his wig, and he's sitting there lighting a pipe, or maybe it's a firecracker, I can't tell which. Um, Not a good idea to do in a place where there may be flammable methane gas in the air, but a nice example of the reckless insouciance that nicely foreshadows the energy economy of the next century and a half. Or our story may begin here. This is 1859. This is the Drake Well in northwestern Pennsylvania, the first commercial oil well in the United States and possibly in the world. Liquid fuel represented another form of plentiful energy that was new, and before long revolutionized transportation and gave rise to a booming synthetic organic chemical industry. Well, all that energy that became available revolutionized the way people lived. And as you can see here, before too long, a couple of decades passed, the human use of energy began climbing dramatically. And most of that energy consisted of coal and oil, and a little bit later, natural gas, which is a kind of an advertising name. It's natural in a sense, but not natural in the sense that many of us use the word these days. And these three fossil fuels, which represented embedded energy from immense time in the past, helped us completely revolutionize the human enterprise. One of the ways we did that was by upscaling our population. Population had been relatively stable during the entire Holocene for about 10,000 years, but with the availability of energy, population skyrocketed so that we're now up to almost 3 times what the population was as recently as when I was born. We also scaled up our economic activity. This is a picture of GDP. What you're noticing now, by the way, is that the curves that I'm showing all look alike, a long, flat line, and then a sudden uptick. And this is economic activity, the gross domestic product of the world, and it has skyrocketed as well. In fact, almost any indicator of human activity that we can think of, from the use of water to transportation, fertilizer consumption, our production of products such as paper and plastic, the number of McDonald's outlets, you name it, any indicator of human activity has skyrocketed in the past couple of centuries, and in particular since about 1950, since the end of the Second World War. This scale up is called the Great Acceleration, and it represents a complete break with the history of humanity. Now, in many ways, this has been a great time to be alive and to be a human. Health and well-being have never been better. These pictures show that illiteracy is dropping around the world. Poverty is dropping even as the global population has increased. Child survival has improved. Life expectancy has improved. Now, all of these health gains are not equitably distributed, unfortunately, but they are real health gains on a global population basis. Good time to be alive and to be a human. But, and there's a but, these gains have come at a cost, and the cost is being borne by our planet. So let's take a look at the planet. Let's say a few things about the context of the planet. First, by way of setting context, if we scale the planet to the size of a soccer ball, then the entire biosphere, from the deepest ocean trench to the very top of the troposphere, is about as thick in proportion as this layer of cellophane on a soccer ball. It's a very small film on the surface of the planet. If we consider all of life on Earth, all of life in that biosphere, it's about 550 gigatons of carbon is represented in this cartoon. Almost all of it is plants, and animal life represents just a tiny fraction of 1% of life on Earth. If we blow up that animal life, we can see that over half of it is insects, a large part of it is fish, and humans, we represent, again, a tiny fraction of 1% of the animal kingdom. Interestingly, we eclipse the number of wild mammals. That wasn't always the case, but we've changed the balance of life on Earth. And we are overshadowed by the amount of livestock that we maintain to feed ourselves. This gives you a little bit of a sense of how humans have altered the shape of life on Earth. Most importantly, we are a very small part of life on Earth. We can also think about the issue of deep time. The planet has been here for 4 or 5 billion years. Life appeared about 2 billion years ago. Vertebrates, less than 500 million years ago. Mammals, just a couple of 100 million years ago. Primates, just 10 million years ago. Our species, Homo sapiens, about 200,000 years ago. We emerged from being hunter-gatherers to growing crops and writing things down and living in towns just 10 or 12,000 years ago. A very brief time. The writer John McPhee has put it beautifully. Consider the Earth's history as the old measure of the English yard, the distance from the king's nose to the tip of his outstretched hand. One stroke of a nail file on the king's middle finger erases human history. So we are a small part of life on Earth spatially, and we are late arrivals temporally. And you might think that given that brief existence, we couldn't really do much to alter the entire planet. But you'd be surprised. We have. The chemical composition of the atmosphere has changed in the last century or so. The temperature of the planet has changed. The pH of the ocean has changed. The distribution of land uses around the planet has changed. We have lost species at a very high rate. So it's true to say that we no longer live on the same planet that our great-grandparents did. It is a different planet, fundamentally altered. So much so that geologists have suggested that we've entered a new geological epoch. Here is a picture of deep time in cartoon form. This very thin black layer at the top represents the Holocene epoch, the last 10 or 12,000 years since the end of the Ice Age, when civilization as we know it arose. And at the top of that is the Anthropocene, the geological epoch defined by the fact that humans have enormous influence over every global process. Now, that concept of the Anthropocene has also introduced the concept of planetary boundaries. And this is kind of an iconic picture. Let me walk you through it if you haven't seen it before. The notion is that on these 9 parameters, climate, novel entities is a euphemism for chemicals that haven't existed before we produce them as humans. Ozone depletion, atmospheric aerosol loading, biodiversity, the way land is used, fresh water availability, biogeochemical flows of phosphorus and nitrogen, and the pH of the ocean. For each of these parameters, there is a boundary beyond which we shouldn't go. If we stay in the green safe zone here, the planet remains stable, and life as we know it can continue, and we can continue to thrive. But if we transgress those boundaries into the red zone here, we risk irreversible system change. And the scientists who developed this framework have actually proposed that with respect to biodiversity, we have crossed the line. We are in the sixth great extinction. And with respect to phosphorus and nitrogen flows, human influence on the flows of those elements now eclipses natural flows. We've changed them fundamentally. Now, you may wonder, where are the people? We can redraw that picture. This is the exact same picture, just redrawn with a big hole in the middle, because those of us in the health professions may be thinking, where are the people? These are all physical processes. So here is a picture drawn with an empty hole in the middle where the people ought to go. Here's the ecological ceiling with the idea of overshoot, and we can insert into it people and their needs. Here's water, food, energy, social equity, peace and justice, all the things that people need. And here is a social foundation below which we shouldn't go. So ecological limits above which we shouldn't go, social limits below which we shouldn't go, and that space in the middle is the sweet spot where we'd like to be. That's called the safe and just space for humanity, a regenerative and distributive economy. This is the model of the donut economy put forward by Oxford economist Kate Raworth. So this situates human health and well-being within the larger context of a functioning world. Now, there's another framework by which to think about the ways in which planetary processes support human health and well-being, and that's the concept of ecosystem services. You may have come across this before. The notion is that when the planet is operating with integrity and in an equilibrium manner, it provides supporting services. Think of the formation of soil. It provides provisioning services, giving us food, water, and other things we need. It provides regulating services. Think of a coastal forest protecting us from floods. And it provides cultural services, like our ability to enjoy the beauty of nature and to be physically active in natural settings. All of these services, as you can imagine, can be mapped to the ingredients of human health and well-being. And that's what's done in this complicated picture from the Millennium Ecosystem Assessment. Here's health, which is what brings us all together today, but it's accompanied by the basic materials for a good life, by security, and by good social relations. And what you can see is that these ecosystem services map directly to health, as well as to other components of a good life. So the bottom line message here, and this is one of the core messages of planetary health, is that we can't be healthy and thrive as a species without having a healthy, thriving, stable planet. And if the planet is dysfunctional, we can't be very healthy either. But as I mentioned, we are not in that situation now. Each of the parameters shown here has changed relatively dramatically in the last century or two, and especially in the last 50 or 70 years, such that we live on a different planet than our grandparents inhabited. But it's important to understand, as we push for health and well-being for all, that it's not only these physical processes that we have to contend with. We also face social and demographic challenges, such as a growing global population, an aging global population, and increasing globalization. These green lines here represent, in the days before COVID, daily airplane flights, an illustration of how closely knitted together we are as a planet. We also face poverty, and related to that, but distinct, income inequality, and racism and discrimination in far too many parts of the world. We also face disinformation propelled by social media. We face increasing levels of populism in the world, and related to that, the rise of authoritarian governments in many, many countries. And we face biomedical challenges as well. Of course, there's the pandemic, but there's also the continued rise of non-communicable diseases and the rise of loneliness and the decline in social capital and social connectedness. All of these things affect our ability to cope with and to manage the planetary disruptions that I mentioned earlier. And of course, as you can well imagine, these problems don't exist in isolation. They interact with each other. That's represented by this iconic picture of a COVID warning sign in California this past summer being engulfed by a wildfire that was potentially contributed to by climate change. So here you've got climate change and a pandemic illness interacting with each other to endanger people. So much so that these interactions are probably best depicted by a picture like this, illustrating the first law of ecology, that everything is connected to everything. This is the notion of a polycrisis. Now, there's one more dimension of our current situation that I'd like to mention, and that is how fast things are changing. So let me show you a couple of slides of the pace of change. This is a picture of biodiversity loss of vertebrate species that are going extinct. And what I want you to notice is how steeply this line is increasing. The rate of extinction is increasing. And these are just for vertebrates. Here, when it comes to insects, the extinction rate is even higher, about 7 or 8 times higher an extinction rate for insects as we have for vertebrates. Here's a picture of ice melting in Antarctica, and you can see that the sea ice loss is accelerating. Here's a picture of glacier loss, and as you can see, it is accelerating rapidly as well. Here's a picture of weather-related catastrophes, rapidly accelerating. So all of the changes that I mentioned, or almost all of them, are not only progressing, but the pace of change is increasing. As that happens, it takes us closer and closer to the possibility of tipping points. A tipping point is an irreversible system change that shifts the state of the world. And that could be, for example, the slowing or stopping of the Atlantic circulation, which maintains climate in much of the northern hemisphere. It could be the loss of the Greenland ice sheet. And these things, of course, interact with each other. The last mention of timing that I'd like to offer you is illustrated by this picture. This is a bit of a complicated picture. This is a picture of various pathways if we are to limit global warming to 1.5 degrees. Each pathway is a colored line, and it differs according to assumptions that we make about the sensitivity of Earth systems to greenhouse gases and the pace of human responses. But what I want you to notice is that every one of these pathways that gets us to limiting warming to 1.5 degrees begins with a downturn in our greenhouse gas emissions right about here. In fact, every successful pathway contemplates that we would cut our greenhouse gas emissions in half by 2030 and get to net zero emissions by 2050. But that's not the path we're on at the moment. CO2 emissions continue to rise. They fell a little bit with COVID and are expected to bounce back as we emerge from the pandemic. So, a complex set of global changes that threaten human health and well-being and the stability of the way we live. These changes are accelerating. We haven't yet triggered the responses that we need to trigger, and those of us in the health sciences know that there is a word for this, and that word is an emergency. Well, one of the responses to this emergency has been the growth of a field called planetary health. It emerged with a manifesto published in The Lancet in 2014. The Rockefeller Lancet Commission on Planetary Health published its big report in 2015, which kind of launched the field. There was a Planetary Health Alliance established in 2016. Academic units around the world, London, Sao Paulo, and elsewhere over the next few years. And now, as Erin was kind enough to mention, we have a couple of textbooks in the field. I was honored to be a contributor to both of these. And so this marks the emergence of a field. Planetary health is defined in relatively complex ways, but the simplest definition is shown here. Simply put, planetary health is the health of human civilization and the state of natural systems on which it depends. So let's work some examples now. I want to pick examples that are very quotidian, examples from our daily lives, the energy we use, the stuff we make, and the food we eat, and illustrate for you how a planetary health approach would help us sort through, tackle problems, and protect human health and well-being. Now, in the energy arena, the most obvious example to talk about is climate change. You all know a lot about climate change. You know that with the increases in the use of energy that I showed you earlier, since it comes from burning fossil fuels, that releases carbon dioxide. You all know that the level of carbon dioxide in the atmosphere has increased over recent years. And you all know that that leads to impacts on human health through a variety of pathways as shown here. I actually don't want to talk about climate change, and I don't want to talk about climate change because I assume that everybody on this call knows a fair amount about the impacts of climate on health, And I want to make the point that even if we didn't have a changing climate, the planetary health framework would still be very useful to us. And so I want to use other examples to illustrate that. But I do want to linger on climate change for just a moment to make one point. And that point is shown here. This is a graph of household income in the US from the low-income households to the high-income households, and the carbon footprint shown on the y-axis. What I want you to see here is that the carbon footprint for those of us who are wealthy is much, much higher than the carbon footprint of the low-income households. If you deconstruct that carbon footprint, it can be attributed to food and to housing and to even the clothing we wear and to the way we travel and to the services we use. The wealthy people are responsible for a much bigger share of greenhouse gas emissions than the not so wealthy people. And that's true on a global scale as well. This is a graph of the world's population with the poorest 50% here and the richest 10% up at the top. What you can see is that the richest 10% of the world's population is responsible for almost half of greenhouse gas emissions, and the poorest 50% for only 10% of those emissions. So again, the same pattern. The wealthy are creating much more of the problem than the poor. But the impacts are felt in completely different ways. Here's a map of carbon emissions, scaling countries by their cumulative emissions. So you see a very large bloviated United States, a very large bloviated Europe, and a tiny little vestigial Africa and South Asia. But when it comes to the impacts of climate change, the pattern is the reverse. Few impacts on tiny little US and Europe, very large impacts on Africa and South Asia, where people are so unfortunate. So this is a core planetary health principle, the principle of equity, that those of us who are fortunate have caused a lot of the problem, and we need to be thinking very hard about protecting and elevating people who are less fortunate and achieving more equity as we develop solutions. The energy example that I do want to linger on for a moment is the question of dams. Now, what do we think about dams? Well, if we look at the greenhouse gas emissions of various sources of electricity, you can see here that coal is quite high, oil is quite high, natural gas is lower but still quite high. And if you look over to the right, hydroelectricity is one of the least greenhouse gas emitting ways to make electricity, and that's a terrific thing. I'm proud to tell you that in my part of the world, in the Pacific Northwest, the Columbia River Basin is almost completely built out with these many dams that you see represented by red and yellow dots. And that's why our electricity in Washington State, where I live, is 2/3 hydro. Much of the rest is renewables of other forms, such as wind. So we have a very low carbon footprint, and hydro helps a lot with that. Dams are being built at a very fast clip. There are almost 3 million dams in the world. Most of those are for flooding control and for irrigation, but 3,500 of them are hydroelectric dams, and another 3,700 are planned or under construction, as you can see here. This is Asia. Here's Latin America. The purple dots represent dams that are operating. The red dots are dams that are planned, and the yellow dots are dams that are under construction. So we're seeing a growth in hydroelectric energy. Now, that has human implications. This is the Three Gorges Dam in China, which was completed in 2006. It's a very big dam. It displaced over 1 million people. It obliterated 13 cities and 140 towns and over 1,300 villages. And that was well documented to cause large levels of stress, of mental health problems, of upending people's lives. And that's just one example of the adverse impacts of dams. In fact, dams represent an important planetary health principle, and that's the principle of complex trade-offs. The benefits are many, as you can see here: clean electricity, a dependable water supply, irrigation, flood control, and recreation. But dams threaten health and well-being in several ways. They alter river ecology, they alter the fluxes of various elements, they emit methane, and there are direct risks, one of which we'll come back to in just a minute, of infectious disease, of population displacement, and of dam collapse in case of disaster. Dams also illustrate another planetary health principle as shown here. Each of these benefits of dams is expected to vary with climate change. In fact, in my part of the world, the amount of electricity we were able to get from dams declined by about 10% over the last couple of years with dry weather, because the flow of water, the amount of snow melt that we had available in the spring and early summer declined, and that meant less water moving through the dams and giving us electricity. As we get changes in hydrology, changes in rainfall patterns, declining snow melt, we will see a decreasing function of many dams. The principle here is that any of the big issues we tackle need to be thought about not just in the present tense, but also in the future tense. We need to think ahead 5, 10, 20 decades, because we know that we live on a rapidly changing planet. Next example I want to talk about regards the stuff we use, and I'm going to talk about plastic. Wherever you are now, sitting in your office, in your bedroom, outside on the porch, if you look around, I'll wager that you will see some plastic. It's a ubiquitous part of our lives. Now, plastic, as you know, consists of polymers of various simple molecules, be it ethylene or propylene or styrene, and plastic is used in a great many parts of our lives. Plastic is interesting in that it is part of the Great Acceleration. It essentially didn't exist before the mid-20th century, and plastic production has ramped up rapidly since then. It now exceeds 320 million metric tons per year globally, or about 40 kilograms for every man, woman, and child on Earth. That means that on average, each of us now alive will account for over 2,800 kilograms of plastic production over our lifespan, or 30 or 40 times our body weight. That plastic goes for packaging, for consumer items, for construction, automotive, and other uses, as you see here. Not only that, plastic production is increasing as the world becomes more and more prosperous. It's expected to double or triple or more in coming years. So plastic is a growing thing. Now, plastic lasts a long time. If the workers who had built the Great Wall of China or Machu Picchu or the Taj Mahal 5 or 6 centuries ago had sipped water from plastic bottles during their breaks from work, those plastic bottles would likely still exist. Now, that matters. What happens to the discarded plastic is consequential. By one estimate, for every human being now alive, somewhere in the world there is about 1 metric ton of plastic. Some of it's in use, but over half of it is waste. Where does the waste go? Well, some of it's in landfills. Some of it's in waterways, a common and heartbreaking sight in many of the world's major cities. Plastic generally floats, so it travels with currents and accumulates in eddies, forming patches that can be as large and imposing as islands. From streams and rivers and harbors, the waste winds its way to oceans, an estimated 5 to 13 million metric tons each year. Driven by wind and currents, the plastic seems to go everywhere, making what seems a local problem a global problem. Plastic has been found in the deepest ocean trenches, in Arctic ice, in Mongolian mountain lakes, on remote island shores. The world's ocean systems tend to concentrate waste in the 5 great ocean gyres that you see shown on this map. Interestingly, the highest concentration of plastic debris ever measured on a beach was on remote Henderson Island on the western edge of the South Pacific Gyre, 5,000 kilometers from the nearest human habitation. Now, plastic waste comes in many categories, from macroplastics like the six-pack holder that literally shaped the life of this unfortunate turtle, all the way down to micro and nanoplastics, some of which are manufactured that way, such as the microfibers in our clothing, some of which breaks down from larger plastics into smaller plastics. Some of that plastic enters the food chain. We know that seabirds eat plastics, mistaking them for food, and an estimated 90% of seabirds, like this albatross, now have plastic in their bodies. But what's even more interesting, perhaps, is the way plastics, the micro and nanoplastics, get into the food web. This is a picture of the uptake of polystyrene beads by zooplankton. You can see them fluorescing green here in these pictures. And as you might imagine, here's the complex food web. The nanoplastics and the microplastics are taken up by very small critters, which are eaten by larger critters, which are eaten by larger critters still, eventually reaching the top predators like this orca or like this human being. We've now seen more and more studies like this one. This is a study of fish and shellfish bought in markets in Indonesia and California to check for the presence of plastics. In over a quarter of the individual fish that were sampled and in half the species that were sampled in both countries, plastic was found. When we eat fish, we eat plastic. And it's not just fish. As you can see here, this is a sampling of recent studies, whether it's sea salt or honey or beer, three of the basic food groups right there, many kinds of seafood. Plastic is found routinely when it is looked for. And of course, if you follow that right through the pipeline, it is in human feces as well in the one small study that has been conducted. So plastics are ubiquitous in our food supply. But plastic isn't just plastic, and that's one of the reasons for health concern. On average, 93% of plastic is the polymer itself, but 7% is additives, plasticizers, fillers, flame retardants, and so on. Not only that, plastic is a really good surface for absorbing synthetic organic chemicals. Some of these chemicals, such as polychlorinated biphenyls, are very persistent in the environment, hence the term persistent organic pollutants, and many of them are biologically active. In fact, environmental loading with chemicals such as these POPs, persistent organic pollutants, is a hallmark of the Anthropocene. And ingestion isn't the only way that these plastics get into our bodies. The consumption study that shows that plastic is found in so many foods also has shown that the mass of inhaled microplastics can equal or exceed the amount we ingest. This diagram is from a just published paper that quantified the plastic content of ambient particulate matter in the air pollution of China's Pearl River Delta. There was a substantial burden with phthalate esters being the major species that was found in air pollution. Now, plastics, together with their fellow travelers, persistent organic pollutants, POPs, travel. The concept of biogeochemical cycles that used to apply to natural things like carbon, water, phosphorus, nitrogen might also be applied now in the Anthropocene to POPs. POPs are fat-soluble. They bioconcentrate within the fat of organisms such as fish, cattle, and polar bears. They're biomagnified as they move from lower to higher trophic levels in food webs, and they spread and oceanic transport as shown here, even in ecosystems such as the Arctic, far from where they were ever produced or used at any kind of scale. One recent study of Inuit people in the Canadian Arctic found that those with the highest blood levels of PCBs were 2 to 4 times more likely to have diabetes than people with the lowest levels. So the planetary health lesson here is that we can change the chemical composition of our planet, and we can do that in global ways. Even problems that seem localized can be global problems. There's another planetary health lesson, and it's a good one. We can make change. This is a map of where plastic bags have been banned or taxed around the world. The red means banning, and the green means taxing, and the brown is a partial ban or tax. What you can see is that many countries have stepped up to make a change and to respond. And interestingly, many of those countries are in the global south. They're low-income countries which are doing fine, making do without plastic bags and showing leadership. Here in our country, change is also possible. The blue states are the states where there are bans on plastic bags, and the light blue states are fees or taxes. But another lesson of planetary health is that there is a lot of resistance to change. These green states are states where there are bans on banning plastic. That is, local ordinances that want to ban plastic bags have been preempted by state law. This is a campaign driven by a lobbying group called the American Progressive Bag Alliance, representing the plastic bag industry. It's an independent division of the Plastics Industry Association. So there are lots of vested interests maintaining the status quo, and that's an important reality of the Anthropocene. The almost last example I want to show you is going to turn to food, and I want to talk about nuts. Now, nuts are an interesting kind of food. If there are any nutritionists in the audience, you'll know that nuts are actually very good for human health. In fact, we have quite a large literature detailing the nutritional benefits of nuts almonds and cardiovascular health. Walnuts are good for the microbiome. Pecans are good to reduce cardiometabolic risk. And if you talk to your nutritional friends, they'll tell you we should all be eating more nuts. In fact, in the nutritional world, lots of interesting questions arise about nuts. What components of nuts promote health? Can we make healthier nuts? How much should we eat of nuts every day? How do we get people to eat more nuts? But in planetary health terms, I would argue that there is one question about nuts that we don't ask or hear very much at all. Where do nuts come from? So we need to think upstream. This is part of planetary health thinking. Well, we all know where nuts come from. They come from the convenience store. They're in little plastic bags, and you buy them and you can just eat them as a snack. But if you go upstream from there, it turns out that nuts come from beautiful orchards like this almond orchard or this walnut orchard. Where are those orchards? Well, these two pie charts show where nuts are produced globally, in this case, almonds and walnuts. You can see that almonds are produced almost, better than 3/4 of the world's supply in the United States. Walnuts are about half from China and about a third from the United States. Within the United States, if we look to see where the nuts come from, they come almost exclusively from California, which has the lion's share of nut production in this country. Now, that's interesting. What do we know about California agriculture and the appropriateness of growing nuts in California? Well, this is a picture of the water footprint of various foods. And you can see that next to beef, the most water-thirsty food to produce on a liters per kilogram basis is nuts. Nuts take a lot of water to grow. What do we know about water in California? Well, we know that the last decade has been a hugely challenging time for California because of a prolonged drought. In fact, if you were just beginning from scratch, this might be one of the last places you would think about growing nuts, right there along with Phoenix, Arizona. It's not the place you would choose to put a water-hungry crop. Not only that, the forecast for coming decades under climate change indicate more chaotic weather extremes, more severe droughts, and less water from snowmelt. So the situation doesn't look like it's going to get much better anytime soon. So here we have a collision of nutritional advice with environmental stewardship. And that raises questions such as, is a cardioprotective diet sustainable? We need to look at the environmental aspects of the foods that we eat, as well as of many aspects of our lives, because the complex system analysis we have to do may lead us to slightly different conclusions than simply asking, are nuts good for health? Well, I've laid out some pretty challenging and even grim news for you, and you must feel a little bit of despair right now. It's actually pretty common to feel despair when you think about these planetary challenges. But there are great solutions in hand, and the last example I want to show you illustrates a great solution. This is the Diama Dam along the Senegal River. Not a major dam, it's only 18 meters high, but it helps to store water and support irrigation in surrounding communities in Senegal. 18 meters is high enough to keep the tide from pushing brackish water up the river. So after the dam was built, it created an ideal freshwater habitat for snails. Now you might recall that snails form part of the life cycle of the schistosoma trematode, or fluke, which is the cause of schistosomiasis. Sure enough, after the dam was built in 1986, snails proliferated along the river, and a fierce outbreak of schistosomiasis followed. But a win-win ecological solution emerged. That solution was prawns. This is a brilliant series of papers, the kind of thing that planetary health research yields, showing that when the river was stocked with prawns, which are predators of snails, a lot of good things happened. One was a dramatic reduction in schistosomiasis, improvements in health. Another was an improvement in health and well-being of people living along the river because they gained a dietary protein source and a cash crop in the prawns. So the solutions that emerge from fusing biomedical, ecological, sociocultural, and economic thinking can be truly inspiring. I want to close now by turning to the subject of hope. This is a picture of despair. In fact, the planetary changes that I described are grim. I recently spoke about climate change to a university class, and I asked how many had confronted despair in considering the issue of climate change. Every hand went up. No surprise, despair is an occupational hazard for anybody who considers contemporary planetary change. But we need to fight despair. It's immobilizing, it's painful, and it doesn't accomplish anything at a moment when we have to be about accomplishing a lot. We need to embrace hope ourselves, and we need to inspire hope in other people. Fortunately, there's plenty of basis for hope, and it's with that that I'd like to close. I'm going to show you quickly 8 reasons that I think hope is not only justified, but imperative, and here they are. First, Cobenefits. Now, this is a good story. What we have to do to shift to a green, sustainable economy and to make the world a place that will last for our grandchildren, shown here, clean energy, well-designed cities that include alternatives to motor vehicles, plenty of green space, ecologically designed low-energy buildings, and so on. Healthy diets, meaning a shift away from resource-intensive meats toward diets that are a little heavier in plants. Green chemistry, so that we're not putting persistent organic pollutants into the environment. What if we lined those up alongside some of the major public health goals we have? Less heart disease, lung disease, and cancer, better mental health, less infectious disease and fewer injuries, healthier child development. Well, here's the good news. We have very solid evidence that clean energy delivers many of those public health goals. Much of that improvement is through cleaner air, but there are other pathways as well, each of them very solidly supported by evidence. We have very solid evidence that well-designed cities deliver those health benefits as well. We have very solid evidence that healthy diets deliver many of those health benefits, and that green chemistry delivers many of those health benefits. So the transition to a green, sustainable economy tackling these planetary health challenges is not a story of deprivation and sacrifice. It's actually a story of better, healthier lives. And that's good news. Reason for hope. Second, the technology is advancing. Here are just 2 examples. Batteries are getting better and better. When we have good batteries, we can facilitate the shift from fossil fuel electricity to renewable electricity. Batteries providing the electricity at times when those sources aren't delivering. Even such difficult sectors as aerospace are seeing massive leaps forward with aviation fuel that may be sustainably produced as well. Technology is advancing. Economics are improving. The costs of renewable energy have tumbled faster than anybody would have predicted, such that in almost every part of the world now, solar and wind are cheaper than fossil electricity. Policy is maturing. Many countries have made commitments to going to net zero by 2050, sometimes even sooner than that. Suriname and Bhutan are there already. A number of other countries have legislated a net zero commitment, and targets are under active discussion in 99 additional countries. They're being discussed today at President Biden's summit, and they'll be discussed in Glasgow at the next conference of the parties of the UNFCCC. Not only at the national level, but at the subnational level, cities are competing with each other to be the first city to go green and to go net zero. We're seeing really interesting legislative initiatives here in the U.S. as the fossil fuel infrastructure that you see here gets banned in place after place, and as infrastructure for the new green economy is advanced by cities that are forward-thinking. We are seeing activism blossoming, as exemplified by some of the pictures shown here, and that activism in turn motivates and pushes policymakers to pass the policies that we need. Public opinion is shifting. This is a picture of the proportion of Americans who are extremely or very sure that global warming is happening, denialism is falling, and belief in the problem is rising. In fact, here's an interesting little snippet of information on public opinion. This was exit polling by Fox News on Election Day, this past November. 70% of the voters surveyed by Fox News favor increased government spending on green and renewable energy. So public opinion is coming along. Culture change is possible. Here I've found some posters from the Second World War. What you see is that the public was urged to use less electricity, to use less food and especially less meat, to buy local, don't buy things you don't need, don't drive if you don't need to. And you know what? Americans met that challenge and made those changes and did it willingly for the greater good. That kind of thing is possible, so we don't need to be cynical about that. Results are emerging. This is a picture of the growth of renewable energy. This is hydro in blue, this is wind in red, other renewables up above. It is growing very, very fast. In fact, a big milestone was that last year renewables pulled ahead of coal. So change is happening. Even in the private sector, we're seeing enormous leadership. This is the automotive sector, and car companies are competing with each other now to be the first ones to go all electric and to provide us with the best choices of electric vehicles, which are much more environment friendly, climate friendly than our traditional internal combustion engines. So for all these reasons, there's no need to despair. There's plenty of reason for hope. Well, I've tried to give you a quick run through of the concept of planetary health, the health of human civilization and the state of the natural systems on which it depends, a framework for doing science and for developing solutions that is people-centered, that is systems-based, that faces upstream and looks at root causes, that is committed to equity, that is oriented toward the future, that is solutions-driven, and that inspires hope. I want to thank you very much for your attention. Wish you all a happy Earth Day, and I look forward to the Q&A.
Excellent. Thank you so much, Dr. Frumkin. That was very thought-provoking. I echo a comment from our audience. Very thought-provoking topic. I will always think twice now when choosing nuts or a bottle of water on an airplane, which is the standard fare. There are a couple questions that I'll consolidate into one. When you think of sustainability, you think of the next electric cars, there's battery operated. Would like your thoughts on the sustainability of those new technologies because of resources taken to create the batteries and then recycling.
Well, a great question, and nothing is perfect. Life poses us with a lot of trade-offs, and one of the points I tried to make with dams, which are a great technology, is that even dams have their downsides. Mm-hmm. So electric vehicles they're much better in terms of greenhouse gas emissions than internal combustion, but they're not perfect. So I think moving toward walking and cycling, moving toward a greater use of transit, developing the technology that we're all using now, the telecommunications, means that telecommuting can become more and more of a reality as we emerge from COVID, and that means reducing travel demand. So there are many dimensions to a complex problem, and transportation is a great example. We are going to have to continue to use resources to travel. There's no way around that. But if we think in a multidimensional way, and if we tally the environmental benefits and the health benefits of each of the possible solutions, we can optimize the answers we come up with. What I'd recommend to everybody is, if you have an internal combustion engine vehicle, think about an electric one. If you have an electric vehicle, think about a bicycle. If you have a bicycle, think about walking, because walking and cycling are going to be healthier for you than driving any kind of vehicle. And if you have transit and can use that, that's great. It's one of the lowest carbon footprints. And by the way, the walking to and from a transit stop, whether it's light rail or a bus, builds in daily physical activity to your life. So the benefits we get from that: cleaner air, physical activity, fewer car crashes, less noise in our cities and towns, multiple health benefits. And so it's one of those many places where, as we make the best decisions we can, knowing that no decision is perfect, we can optimize a lot of good outcomes.
Excellent. With the last amount of time that we have with you, I would like to ask your ideas. We're a research institution. Many of our attendees are scientists. What do you see as the next and the biggest research questions and areas that we need to move forward on?
Well, I think we need to understand health threats. And so this is, if you will, the diagnosis part of the issue. How will climate change reduce the nutrient content of foods? How will rising sea levels affect habitability of cities? Many, many questions. We know a lot about the impacts of global environmental change, but there's a lot we need to know. Second, we need research on solutions. So what sorts of crops will be most viable in the world 50 years from now, most nutritious, most economical to grow? What sorts of heat wave preparedness plans are going to be most effective at protecting people from the impacts of heat? So there's a whole science we might call solutionology, developing solutions to protect people from the hazards that we document with research. Third is co-benefits. So as we do things like change our transportation system and change our energy system, we need to understand which ways of doing that are as health promoting as possible. So that means linking health research with research in energy, transportation, agriculture, and so on, so that developing environmentally friendly ways to do all those things also develops healthy ways to do those things. We need a lot of social science research. How do we communicate these issues to the public? How do we change policy? Why is there a no-do gap? Why do we know many of the things we need to do, but we don't do them? And how do we overcome any of those social and political barriers? Across all of that research, we need to be very multidisciplinary. And that means for those of you who train students, don't just train them in toxicology, but do a little ecological thinking, do a little geographic thinking, and blend all of that. We'll be hearing from NIEHS in the next session. One of the very promising things is that we're seeing more and more move toward interdisciplinarity and synthetic science through funders such as NIEHS.
Excellent. Well, I in the audience want to thank you immensely for your deep dive into the issues that we are facing, but also the hopefulness that you've brought to this conversation that we can make change. So thank you. Thank you so much.
Thank you very much for the opportunity.
Fantastic. Excellent. So moving on in our program, we wanted to highlight environmental health disparities and environmental justice issues that are facing our nation and our region, and also in the local setting. And to facilitate and moderate our next session, which is a panel of wonderful speakers, Dr. Danielle Stevens-Watkins is going to be the moderator. So I'll introduce her and then turn it over to her and the esteemed panel. Dr. Stevens-Watkins she received a PhD in counseling psychology from the University of Kentucky. She also has her master's in clinical psych from Spalding University. She is now the Assistant Vice President for Research in Diversity and Inclusion here at UK, and she leads our Unite Research Priority Area. She has been funded by NIH for decades and has research focusing on health disparities and barriers to service and utilization among African American populations. So Danielle, we are very glad to have you as part of this event, and the panel is yours.
Good afternoon, everyone. Thank you so much for joining us. I have the pleasure to introduce our three panelists for this afternoon panel session. I will start with our first panelist, Heather Henry. Heather Henry is a program officer with the Superfund Research Program at the National Institute of Environmental Health Science, located in the Research Triangle Park in North Carolina. At NIEH, Heather manages research grant programs, including university grants and small business grants, with topics ranging from toxicology, environmental cleanup, community engagement, COVID-19, and disaster response research. Heather is a member of the NIEHS Environmental Health Disparities and environmental justice faculty and is involved in several efforts to promote diversity, equity, and inclusion at NIEHS. We are so fortunate to have Heather this afternoon. Thank you, and I want to introduce Heather.
Thank you, Danielle, and thank you so much, Erin, for the invitation to talk here today, and very much enjoyed the prior presentation by Dr. Frumkin. I'm going to be talking about the national perspective, or a national perspective, regarding environmental health disparities, and I'm going to be taking an attack talking about research, legislation, as well as coordination. So I thought I'd start out with some definitions. A health disparity is a health difference closely linked to social, economic, and or environmental disadvantages. So when it comes to an environmental health disparity, these are disparities related resulting from stressors, including environmental exposures, exposures that might be related to natural or man-made disasters. And these disparities amplify or increase existing health disparities in vulnerable communities. And by vulnerable communities, we tend to notice that these are communities experiencing lower SES, closer to pollution, limited health care, maybe experiencing a lifetime burden of multiple exposures, as well as limited literacy. Environmental justice goes alongside with environmental health disparity and is sort of an aspirational goal to achieve a fair treatment and meaningful involvement of people, regardless of race, color, national origin, or income, with respect to the development, implementation, and enforcement of environmental laws, regulations, and policies. And I think it's important to note that when it comes to environmental health disparities, a majority falls on low-income, minority, tribal, and indigenous communities. They're more likely to be bearing the environmental insults that are involved with environmental health disparities. So I'm going to start by giving a context of what's happening at NIEHS. We're not the only institute from the National Institutes of Health that is working on environmental health disparities, but certainly the work that is being done at NIEHS is illustrative of other efforts. And it's a very important aspect of our own strategic plan to uncover and understand these social determinants of health, as well as promote environmental justice. So I'll start with research that's happening at NIEHS. Those of you may know we're located in Research Triangle Park, North Carolina, and we have several scientists working there in laboratories and running contracts. As it pertains to environmental health disparities, the National Toxicology Program does several toxicity testing related to chemicals that might be associated with ethnic personal care products, diseases that are more common among minorities, or pesticides and migrant workers. We have an active epidemiology group working in several communities looking at environmental justice issues. And we also sponsor community forums with our director, Rick Wojcik, and then have coordination efforts for groups that relate to environmental health disparities, such as disaster research, as well as environmental global health. And NIEHS is also involved with COVID activities that are at the NIH level. And as it relates to environmental health disparities, there are two programs that work directly with underserved populations. And NIEHS has a management role for some of those. RADx Up is a testing strategy for underserved populations, and RADx-RAD is a wastewater surveillance means to assess COVID in communities. But I'm going to turn gears now and talk more about the work that NIEHS is funding. And we have a program for environmental health disparities that look at basic and epidemiological as well as social scientific factors that explain the burden of disease in lower socioeconomic populations. Partnerships for Environmental Public Health has a research to action program. This highlights the importance of community engaged research. The worker training program provides work skills to impacted communities. The Superfund research program is an example of the multidisciplinary research that Dr. Frumkin was talking about, and it has a systems approach to problem solving. And then lastly, we have a time-sensitive research grant program, which enables small grants encouraging partnerships between researchers and disaster-affected communities, many of whom are some of the vulnerable communities that I was mentioning previously. So just to give an example of one of the environmental health disparities research centers, this feature is on MADRES, which is a maternal development risks from environmental and social stressors. This center is out of the University of Southern California and focuses in on low-income Hispanic women in Los Angeles area. And just want to point out some recent work that they've done mapping COVID case rate pollution in public transit and housing density. And just to make one little take-home message here that this type of work, this type of interaction with communities has really enabled the community outreach to let the MADRES families know more about COVID susceptibility. And the research to action, again, this is a program that really focuses in on community partnerships. And I'm mentioning just two of them here. They're both relevant to Kentucky. The Mountain Air Project focuses on disparities in Appalachian communities with regard to respiratory health. And a recent program is one looking at disinfection byproducts also in the Appalachian area. And again, in terms of another take-home message, just how important it is to engage communities in research, especially the type of research that NIEHS is doing. Not only does this help build capacity, but there is evidence that it improves intervention success. And I want to point out that the Partnerships in Environmental Public Health also has a vibrant podcast system, and they had a recent feature on another Kentucky example. This is out of Louisville. The Green Heart Study looks to examine the impacts of green neighborhoods on heart health. And this type of intervention, I think, also points to another take-home message, is just sustainable solutions. So this work is based on rigorous science. The solution itself really gives back to the community through creating additional green space. And talking about giving back to the community, the Worker Education and Training Program has had a long-standing interaction in training low-income minority communities who are in communities that are impacted by hazardous substances. So through providing job training, it has really raised the capacity not only of individuals but also their families by giving them additional livelihoods. The recent work that has been undertaken by the Worker Training Program is to fund specifically COVID-19 essential worker training. And so just to again make another take-home message about job training and how this activity not only advances cleanup, but also improves the livelihood of individuals and families. And the Superfund Research Program, this is the program for which I am a part. And as mentioned before, this is a highly multidisciplinary research program that has biomedical, environmental, engineering research, research translation, community engagement, a very important cross-sectoral training. So training the next generation to know how to converse with many different sectors. And then data transparency and integration is also an important part of these centers. So a lot going on in these centers, and maybe a point I just wanted to make relevant to environmental health disparities and environmental justice is something that the SRP is moving towards as part of our new strategic plan. That's a systems approach. And a systems approach at its best means inviting multiple perspectives to the table to understand a full system in which a problem exists, allowing you to possibly find many solutions in multiple sectors. And, you know, taking the point home just a little bit more, you know, as being a part of the National Institute of Health, of course, we're very interested in health disparities and biomedical issues and dysfunctions. And in some cases, solutions are found through biomedical interventions, such as pharmaceuticals. But, you know, in many cases, you know, we're finding that it's not always a biomedical solution. There may be several non-biomedical solutions. And I don't think the Superfund research program is the only one doing this. I think the groups that I've talked about prior to this are also showing how sustainable solutions can be really broad for improving health. Again, having interventions that are based on science, identifying multiple ways to reduce exposures, that allows you to tailor interventions to the community, make sure that it is in keeping with economic and other practical concerns. And as mentioned in the prior presentation, you can address one problem by bringing a solution to other problems. So you can give back to the community and in some cases address other issues of inequity. Just briefly wanted to touch on some ongoing work within the centers and make the point about how important it is to communicate risk and make informed decisions. You know, there's work at the University of Kentucky on diet and health. Northeastern University is working with the population in Puerto Rico about risk uncertainty for several contaminants that are found in the study population. Water testing, water treatment, and healthy fishing are also ways that our grantees are bringing science and helping individuals make personal choices to reduce exposures. And then stepping onto a larger scale, communities making informed decisions. Having communities at the table for remediation decisions is very important, and the role of our university centers to help broker an understanding of the implications of some remediation efforts, such as PFAS incineration and dredging. This is really important to communities to feel confident that the solution is not causing additional problems to their community. And with climate and extreme weather events, there's also tremendous opportunity to understand and try to suggest better urban planning to prevent some of the vulnerabilities of communities who are impacted by extreme weather events. And that's a good segue to talking about other national efforts on the horizon, being that climate change, the executive order recently released, has several provisions for environmental justice. So Justice 40 is an initiative originating from a grassroots effort, but now is a part of the executive order that calls for an investment of 40% of federal activities for climate change to go to disadvantaged communities. In addition, they'll be ramping up mapping screening tools to make it easier to identify vulnerable communities in a climate and environmental justice perspective. And the executive order also calls for the establishment of a White House Environmental Justice Advisory Committee. Their next meeting is April 28th, so it might be interesting for those who attend. Of course, it's virtual and you're able to participate that way. And also the COVID stimulus package included $100 million in funding for environmental justice grants, as well as grants to state and local governments to reduce air pollution in marginalized communities. I just want to talk about the Department of Health and Human Services, a couple of other activities. The ATSDR just released a community stress resource center. And this is a tool for helping communities understand how they can reduce stress and build resilience especially as it relates to environmental contamination. And also want to mention Healthy People 2020. This is an excellent resource for understanding health disparities through time. It pulls together resources from several databases so you can actually see and measure how ethnicity and several other socioeconomic factors impact a disease outcome. And related to that is Healthy People 2030, which sets goals for the future for reducing health disparities. And among those goals are several that relate directly to environmental health disparities. Here's an example of homes with safe water. Lots going on in the federal level, and so coordination is very important. And the Interagency Working Group on Environmental Justice is that group that helps pull together and coordinate activities that are happening. Great resource for funding opportunities and events related to environmental justice. And more recently, they held a series of town halls on COVID and natural disasters and underserved communities. And I believe the report is due out in August. EPA has several environmental justice resources. They award grants. They have a screening tool that I mentioned previously. It's going to be a part of the climate change package. And then they also have reports on successes in EJ communities. And finally, the National Environmental Justice Advisory Council is a group that informs the EPA, and it's coordinated by them, and they also have public meetings. So that was a real whirlwind of national activities. National Institute of Environmental Health Sciences, I think, gives an idea of the type of work that is ongoing in the federal government. Basic to applied, data-driven research, community-based interventions, building capacity, creating value within a community, and taking a systems approach to solving problems. The White House initiatives, as well as accompanying legislation, I think is an indication that we'll be seeing more and more of an emphasis on environmental health disparities and environmental justice. And with that, this builds on several excellent resources and products out of the Department of Health and Human Services, as well as the Environmental Protection Agency. And then again, just to point back to that kind of overarching idea that, you know, we can look towards sustainable solutions to really improve the health in vulnerable communities, not only based on understanding of exposures, but helping people make good personal choices, helping communities make good decisions about remediation and urban planning, and then also be ready for those surprise events that come up that we don't expect, like COVID-19 and other climate change issues. And so with that, I want to point to you towards a request for information that is out and due tomorrow for the NIEHS, inviting comments and suggestions to advance and strengthen racial equity, diversity, and inclusion in the biomedical research workforce and advance health disparities and health equity research. I also have posted on this webinar format a document that has a list of funding opportunities and other resources, some of which are listed here. And so I'd like to thank you as an audience, thank the organizers, and a big thanks to the real environmental health disparity and environmental justice experts at NIEHS who provided some help to me in putting this slide together. So thank you. Back to you, Danielle.
Thank you so much, Heather, for presenting. If you all could keep your questions to the end, and we're going to present those questions to our panelists at the end of our last presentation. So please make sure you document your questions in the Q&A box, and I will be revisiting that box at the end of our panel. Our second presenter is Amanda Lefevre. She is the Deputy Commissioner of the Department for Environmental Protection. Amanda serves as the Deputy Commissioner, and she previously served as the Director of the Division of Compliance Assistance, DCA. She specializes in enhancing the educational offerings in DCA and its programs, which includes compliance assistance, brownfields, and the state's environmental leadership program, KY Excel. She serves as the chair of the Association of the State and Territorial Solid Waste Management Officials, Brownfield Focus Group, and the vice chair of the CERCLA and Brownfield Subcommittee. Amanda earned a bachelor's degree from Brescia University and a master's degree in public administration from the University of Kentucky. Amanda is a Kentucky native, originally from Falls Rough, Kentucky. Welcome, Amanda. Thank you.
Thank you so much, and thank you for having me here today with such wonderful speakers. I'm honored, and I just want to talk to you a little bit today about our work within environmental justice within the Energy and Environment Cabinet, and how we're trying to advance environmental justice and community engagement in order to, help address those disparities, health, education, and economic disparities that we have in our communities. So, and my cat decided to take make an appearance today, so apologies. But the thing about EJ is it's been a part of my career within Department for Environmental Protection since day one. I've been with the Brownfields program most of my career, and if you're familiar with Brownfields, that is basically working with communities to assess and remediate properties that are contaminated or thought to be contaminated. So it's your urban blight, it's your rural areas where factories have gone out, it's anything from dry cleaners to mine-scarred lands to old factories and everything in between. So I've spent my career with environmental justice because it goes hand in hand with brownfields and what we do, because we work directly with communities to redevelop these properties and get them back into reuse. And that could be anything from an urban garden to a new business that might provide jobs to social engagement opportunities. So it can be whatever that community wants. And those are the best redevelopments, is when you can work directly with community and it's a community decision of what that redevelopment is. So like I said, I've seen it all. I've worked in urban settings and rural settings. I've seen environmental justice, in terms of income and race. I've worked with coal communities, with the ebbs and flows of that industry, as well as other industries. If you go to west side of Louisville, you could see everything from chemical factories to everything else. So, it's a little bit of everything, but the impacts are universal. These are the communities that have issues with safe and reliable drinking water, a la Martin County, which we're working with really closely right now. Places have issues with access to food. The local convenience store should not be your main source of food, when you can. Healthy fruits and vegetables are really what keep you healthy, not only weight-wise, but cancer risks and everything like that. You may not have access to health care in these communities, and of course there's fewer opportunities for jobs, so you can either move up, move out, or stay in your neighborhood and advance it. So there's certainly challenges, and so environmental justice is near and dear to my heart. And with my particular job at DEP, it's very part and parcel to it. And so I've seen a little bit of everything. But I will tell you, the one thing that really was an aha moment for me, and I think part of our challenge in DEP when we're talking about a new environmental justice framework, which I'll get to here in a minute, is giving all of our employees that aha moment that really brings it home to them. But early in my career, I was in the west end of Louisville at a community health and safety fair. And there was a mascot there. He's really, really brightly colored. I'd never seen him before. I grew up with Louis the Lightning Bug and, things like that, but I'd never seen him before. I went over to the booth, and he was Wally the Shelter-in-Place Turtle. And he teaches kids about sheltering in place when there's some sort of environmental emergency, chemical spill, something like that. And apparently he's originated in a lot of the bands where there are all the chemical industries in the South. But it was that moment where, even though I'd grown up, somewhere between middle class and poor, and we had, issues with, bills and stuff like that, I had never really had to think about that part of safety for me. What is it like growing up where that is necessary, where you have to have a mascot to teach you about sheltering in place? So that was a weird little aha moment, and it's really stuck with me. So, but what we really need is that for our other cabinet employees, because we have people who do permit applications. Well, that's mostly calculations and things like that that may not be out and about in the public, but we want all of our employees to really understand that everything that we do at the cabinet has some sort of environmental health impact to someone somewhere. So we are undergoing a process where we're trying to really ramp up our environmental justice efforts and how we do business here within the cabinet. So just a little background, of course, environmental justice is born of the civil rights movement, and specifically there's some key events, the Memphis sanitation strike and the Warren County PCB landfill that really sort of kicked off the environmental justice movement. And that gave way to executive order in 1994 under the Clinton administration that really made the fair treatment and meaningful involvement of all people, regardless of race, color, national origin, or income, part of the, federal landscape. It's that environmental justice, goal there. So, and as they've had to implement it, of course, it applies to all the federal programs. We are a designated state. We enforce these federal programs. So the Clean Air Act, Safe Drinking Water Act, RCRA, all of that we inherit from the federal agencies. So we automatically, have to, implement and internalize those environmental justice frameworks, and we have. I mean, we do open meetings, and we do, public notification for permit applications and things like that. But there's also that, want to do more. And I think that, the Beshear administration came in, and I think one of the first few things over the last summer is we realized that we needed to look at our environmental justice framework and what we're doing, and we proposed a new one. So this is something that we're currently rolling out. We actually just started it, but it's an effort to really make our efforts more fruitful and be more engaging with the public and with our communities when it comes to environmental decision making. So what we really want to do is raise awareness of EJ within EEC, some of those aha moments like I was talking about. We want to really work on effective community engagement and involvement, and not just passive notification, and really work at communicating information better to folks. There's a lot of agency program evaluation that we need to do, and integration of EJ into different decision points. And of course, training internally and externally, and also using some of the resources that were mentioned in the last presentation. There's lots of good things out there for us to use and for us to communicate with and for us to decision make with. So it's really sort of internalizing all of that stuff and making it part of our everyday business practices. So the first thing I want to talk about is a little bit is community engagement. And we as a regulatory agency, we follow the letter of the law. So there's certain things we can and can't do. But we do know that we can build relationships with EJ communities. So some of the things that we can't do, we can work with our partners. So we really want to work on building relationships with those organizations that are grassroots, that really impact, communities at the ground level. We want to provide training and educational materials to people. If you've ever read an environmental permit, they're not so easy to read. Sometimes, we have very, very technical documents. So, working on materials so we meet people where they are and meet the needs of the audience they're intended to inform. We're going to be looking at open communication, public notification and involvement, really doing effective public meetings and hearings. Once again, meeting people where they are and their needs, and adapt our methods of communication to community needs, special populations, whether that is Hispanic community or large Bosnian community. What type of language needs are there when we communicate to different audience? So really just looking at all of those things, in terms of engagement. We also want to look at program integration. So program assessment, looking at everything that we do, looking at our decision points. Where can we really integrate environmental justice as we go through? How do we implement that? And we have permitting programs. We have those corrective action programs. I think Dr. Henry mentioned, having people at the table when we make remediation decisions. Of course, brownfields, regulation development, funding and grants. Do we need a brownfield criteria in our funding applications as a decision-making tool? And planning. And I will say, and even in our proactive programs. After this, I'll be talking about Kentucky Excel, which is our environmental leadership program. How do we challenge our members to, take on environmental justice activities to really, or projects to help those movements and communities. And then there's internal and external training. Once again, training our staff on environmental justice. What does that mean? How does your job, what you do, how does it impact people out across the state and our communities? Teaching about risk communications. How do you effectively communicate risk? And then program-specific training. But then there's also the external audiences. We have a lot of tools. We need to do a better job of teaching people how to access and use the information that we put out there. And then we need to teach people about the permitting process and how do you get actively involved in that? How do you read a permit? How do you offer comments on a permit? So there's all sorts of opportunities for us to better increase that engagement and increase understanding between our audiences. And of course, as before mentioned, there's some great tools out there for us to use as regulators when we're talking about assessing environmental justice and what it means in these communities. So there's EJ Screen, which you mentioned. Of course, there's going to be an enhancement. So it's already a great tool. We have our toxic release inventory, community right to know, and then Kentucky has something called Enviro Health Link, which is a lot of our environmental health indicators. So there's lots to be done within EEC and DEP, and we're going to be looking at all of our programs, looking how we can educate staff and how to really get people involved and get our employees involved in that environmental justice framework. So I hope a year out we have some really, really great things to talk about in this. I'm excited, and I think this is something that can have great impacts for the citizens of the Commonwealth who bear the undue burden of a lot of the environmental decisions that have been made over the years. So with that, there's my contact information. Should you have any questions after this, please feel free to contact me. So thank you very much.
Thank you so much, Amanda. We really appreciate it. Our next panelist is Donovan Taylor. He's completed a Juris Doctorate from the University of Kentucky College of Law and has management experience in business and tax strategies, law and legal practice, and community organizing and development. He currently serves as the manager of the Plan Room, a nonprofit business accelerator focusing on capacity building for minority-owned contractors, subcontractors, architects, design firms, and suppliers in the construction industry. Donovan works with the Chickasaw Neighborhood Federation, Rubbertown Emergency Act, REACT, and the West Louisville County Community Task Force to address area pollution concerns. Thank you so much for joining us, Donovan.
Hello, thank you. Good afternoon, and thanks for having me today. And thanks to our previous panelists as well for our institutional on planetary impact of pollution and our institutional activity. I'm going to bring you home to the neighborhood and neighborhood activity as it relates to environmental justice and pollution. I am a resident and native of the Chickasaw neighborhood, which is located in Western Louisville, which is a unique and beautiful neighborhood. I don't know what's going on. Chickasaw was established in 1922 after the establishment of the Chickasaw Park that was designated for Blacks in the city of Louisville. Chickasaw is a neighborhood made of 26 different subdivisions. I don't know what's going on. And our boundaries are the Ohio River to the west, West Broadway to the north, 34th Street to the east, and on the south is Miles Park, the industrial park. Some of the advocacy and accomplishment of the Chickasaw neighborhood is the vacant and abandoned property improvements, Chickasaw Park improvements, and housing and quality of life preservation. I don't know why I keep going back to that. Chickasaw is a fence line neighborhood, and that means that we're a neighborhood that's located near a dangerous industrial and commercial facilities that put residents at risk for daily toxic pollution, chemical releases, and exposure. Chickasaw neighborhood is located near the Rubbertown Industrial Park in Western Louisville. Fence line areas are disproportionately Black, Latino, and individuals living in poverty. Fence line areas are more heavily impacted by pollution due to low access to healthy food and other environmental factors. Cancer risks are higher for residents living in fence line neighborhoods, which is a major concern for us in Chickasaw. Rubbertown Industrial Park is an industrial area with companies that are producing a variety of toxic chemicals and materials. For decades, West Louisville and nearby residents have complained of the quality of life and health problems attributed to Rubbertown. I just remember as growing up in West Louisville, and definitely there was horrible foul odors that were being emitted from Rubbertown that has recently been addressed. However, the residents are still concerned about the pollution issues. I have to keep messing up. The environmental impacts of neighborhoods, and particularly Louisville, living in and nearby dangerous facilities. In Louisville, 60% of our residents live within 3 miles of dangerous facilities. When it comes to our Black and poor populations, 92% of our residents live near fence line areas. Louisville ranks top on schools and medical facilities located within fence line areas. And high-risk chemical and commercial facilities threaten resident health, quality of life, and even neighborhood culture. And those are the issues that we have here in West Louisville and in Chickasaw as it relates to Rubbertown and environmental pollution and the quality of life. In particular, we have a park that basically borders the Rubbertown Industrial Park, and that impacts the ability to actually live, work, and play within the neighborhood based on the impacts of the pollution and exposure to pollutions. the fence line neighborhood activism and advocacy. For decades, resident organizations such as Rubbertown Emergency Action and the West Jefferson County Community Task Force have advocated for more action and controls in areas of air emissions and pollution. Definitely want to recognize Ebony Cochran, who is the lead at the Rubbertown Emergency Action Group. She has been a great benefit to our Louisville community on addressing area pollution, as well as Arnita Gatson with the West Jefferson County Community Task Force. Due to basically strong community action, in 2005, the city of Louisville ratified this Strategic Toxic Air Reduction Program, which is known as STAR, as an effort to reduce toxic air contaminants in the community. This is kind of a very innovative and unique program that is relevant to Louisville on addressing environmental pollutions in the community, and has been a great benefit on improving some part of our air quality. In 2018, REACT collaborated with 8 other U.S. communities to work together through the Environmental Justice Health Alliance for Chemical Reform to research solutions for fence line areas. And what do you know, we've just been very active on addressing this and our quality of life and just, how we live and our health impacts in the city of Louisville. And when it comes to the west of Louisville, we have a lower life expectancy as it relates to individuals in other parts of the county. And so this is definitely an issue that we give great attention to. And one of our key components is finding solutions and advocating for solutions for our environmental pollution matters. And some of the solutions that we kind of push forward for the community is that require that these industrial facilities share information on hazards and emergency response plans and solutions with workers and fence line communities. When we're worried about and considering how the impact of quality of life of these industries have on residents, we also look at and very concerned about the workers who also come back to the community, and these pollutions may impact their families. So definitely this effort is very collaborative on addressing all aspects of how these industrial pollutions impact our communities. Strengthen and enforce health and safety guidelines is a strong component that we advocate on the community level. Prohibit new and expanded facilities near homes and schools. And as previously would address about reading and understanding permits, that's something that we're working through in our community of really getting a notice of when those permits will come out and how neighborhood groups and individuals can respond to permits for new facilities and expanded facilities nearby our communities. And so that's something that we are definitely concerned about. Require facilities to continuously monitor, report, and reduce emissions pollutions, as well as require facilities to use and store chemical and materials to adopt safer processes whenever possible. And when it comes to the Chickasaw community, we are a small but aging community. And when it comes to addressing being so closely located near Rubbertown and these industrial and chemical plants, one of the issues, the possible explosion or disaster that may result at these particular plants and how the community can respond. And we definitely are pressing that the city and state put forth a evacuation plan for the neighborhood just in case of that particular situation happens. As we was addressed earlier about shelter in place, oftentimes when we're dealing with chemical exposure, one of the things that they kind of encourage the residents to do if there's an issue is to shelter in place. However, when you consider in West Louisville and in the West Louisville homes, which are many of these homes are aging and old homes that are porous, and so therefore actually a lot of the residents are concerned that by just staying in the home, does that really reduce my exposure to toxic contaminants or maybe in the air? And so if there's another solution that's possible of actually not sheltering in place, but actually evacuating from the area and meaning that many of our residents are elderly, many of our residents do not have transportation. There needs to be a concerted plan to put in place, if it's necessary, to evacuate residents from these fence line communities when there is a major disaster that may occur. And because Jeff, I think, if I can think back, it was around in 2011 that one of the chemical plants at Robertown actually had an explosion that resulted in the death of two of his workers and serious injury to another two workers. And the community was very concerned on what will that explosion impact on the community. We were told that the impact would be minor, and then the community of being trusting of the information that's being shared by these companies and these public agencies. And so just working together with the community and engaging with the community to build trust, to come up with better solutions, and to better address environmental pollution overall. When it comes to that, when we in neighborhoods, we're not looking at quality of air and our quality of water, but also the quality of our soil as well. In many of our urban communities and definitely our low income communities, there's a press for better food access, but an issue with encouraging gardening within these communities is the soil, and whether the soil is contaminated, and whether gardening in these communities with this soil is a viable option to improve their health. And so overall, the Chickasaw, our strong community, we have some great advocates, but our work is collaborative not only with other neighborhood groups, but community groups that are addressing this particular issue. This is a community-wide issue that requires all of us to be involved. And we definitely, as a community group, look to partner with our educational institutions that can provide us with the resources and the information needed for us to have a better stance and be able to advocate for better solutions for our communities. The next slide just provides you with some resources on activities about environmental justice in Louisville, and particularly in the Chickasaw neighborhood, and activities involving REACT and the West Jefferson County Community Task Force. And with that basically concludes our presentation regarding environmental justice and impacts for the Chickasaw neighborhood. And we definitely welcome any questions or concerns that you guys have that I can address.
Thank you so much, Donovan, for joining us this afternoon. As our listeners have listened to our panelists, again, please put your questions in the Q&A. Your talks have all highlighted, so this is for all of our panelists, all three of our panelists this afternoon. Your talks have all highlighted the importance of making environmental health disparities a top priority for national, state, and local agencies. I want to first thank you for the work that each of you are doing. Thank you so much. A question. I'm sure that many of our audience would want to join in the efforts of addressing these disparities. What suggestions do you have for our audience and how they can get involved?
Well,
if I may jump.
Okay.
Go ahead, I'll yield.
Go ahead, Heather.
Sure. There was a document that should be available in the resources, and that has a lot of funding opportunities, announcements, podcasts to learn about more research that's ongoing. And then there's also a request for information. So these are great ways to get involved and inform what's happening, at least on a national level. And then, of course, always encourage being aware of legislation that's going through, but whether it's in the national, state, or even in your local community, and making it known, how important these environmental health disparities and environmental justice issues and initiatives are to you. Thanks.
If I may add in, I would just encourage individuals, definitely lay individuals, to just get involved in your neighborhood or community groups that are addressing environmental issues. They definitely would need your help, and that's just definitely a collective way to addressing it, and definitely, and creating partnerships with other agencies, and as well as, as far as here at UK, is working together on community action, and more importantly, collaborating to put forth and advance policy changes that can have a positive and beneficial impact on our communities.
And I want to, echo that, we always appreciate public input when it comes to regulation and policies, because, sometimes we don't necessarily know all the caveats unless people make us aware. So we appreciate public input. So hopefully we'll be making that easier for folks to, identify and to provide comment, and of course, getting involved at the grassroots level in your community, and really getting to know your community needs is always important. And often, we can, help people connect to resources if we can work with them on various and sundry things. And I will say that we have an environmental leadership program where we have people do voluntary projects for environmental improvement. So we'd love to work with some local grassroots folks and maybe connect them with entities looking to do good in their communities too. So it's a match where maybe we can get someone to pay for raised beds for a community garden where the soil doesn't, where the soil becomes a non-issue. So I would love to maybe try to find ways to make that happen too. So I think if we can sort of communicate and make those connections, a lot of great things can happen. So.
We have another question.
Well, we welcome.
Go ahead. So we have another question.
No, I was going to say.
Go ahead, Donovan. Sorry.
No problem. I'll just say we're welcome to partner with you guys at UK here in West Louisville. So definitely reach out.
Good deal.
Thank you so much. And one question is specific for Heather. How will President Biden's climate plan impact the research priorities at NIEHS? I'm not sure if you.
Well, certainly very directly. I mean, when a president has an agenda that, calls for, for example, the Justice 40 calls for reinvestment in communities that are impacted by climate change. So that means that federal investment will need to be directed, and we'll need to pay attention to make sure that we're reaching that 40% level. So that's one example. Sometimes when legislation like this goes through, it means the creation of new funds. So it leads to enhancement of opportunities like the ones that I described previously. And so that is too early at this point to know if that's going to be the case, but that's certainly another way that it would make those priorities more known to NIEHS. And then the other aspect I mentioned is the White House Environmental Justice Advisory Committee. When committees like that form and look across the government at opportunities, they also identify gaps in research, and that is used by our institute to develop statements about the types of work that we feel is necessary, and those get advertised through notice of intent to publish or other means that come before requests for applications might go out. Thanks for that question.
Thank you so much, Heather. Another question was, can the study of the effects of strip mining and mountaintop removal mining on the health of nearby communities now be completed? It was shelved during the last administration.
Well, what I can say is that the United States Environmental Protection Agency has developed a new mountain and minerals division. I'm not using the right name there, but I do know that the impacts of mining is something that is very much front and center on this new office within the EPA. So I don't know that there were reasons, within the National Institute of Environmental Health Sciences, and I think it's true for several other agencies doing funding. A lot of times the work is proposed by the applicant. What the questioner described is something that does sound like it falls. It does sound like it falls within the NIEHS mission, and talking with a program officer might be a way to find out how the work that they are interested in doing could be funded, because I'm not aware of any restrictions against that, just that there might not have been any specific announcements going out about it. Thanks.
Thank you again, Heather. And I want to take these last few moments to thank our audience and again thank our panelists. Health disparities and health equity work across our neighborhoods and how the environment impacts us all is a extreme top priority. And so thank you so much for all of your hard work. And I hope our panelists, or I hope our audience was moved to think about action and how we can all work together to impact change. Thank you. Erin, do you have any closing remarks?
Yes, thank you. Getting my webcam back on. That was remarkable. I'm just amazed at the great, excellent work that is being done, and still the need that is still there, that we still need to take up the torch and do work. So thank you, everyone. I want to let everyone now take a break. We have a much needed personal comfort break. We will begin again at 2:05. We have an incredible lineup of breakout sessions featuring cutting edge research, environmental action that you can get involved now with water quality and water monitoring. EnviroAtlas is here with EPA. And then please join us following the breakout sessions for a final wrap up. We look forward to seeing you all back in the breakouts. Thank you. We'll take 5-6 minutes. See you then.